Once upon a time, in a galaxy far, far away, there lived a land full of people who never got sick. With access to free healthcare and an equitable system with short waiting times and great quality of service, these people lived happily ever after. The end. Now, this may sound all well and good, but what if it was possible? What if there was a healthcare system with no issues? What if we could create a utopian healthcare system like the one in the story? What would it look like, and what would it change? Now, I admit, perfect is pretty hard to achieve, but what if we were able to combine all the best features of the current leaders in healthcare? Would this, in turn, create a perfect system? Now, the recipe for creating a perfect healthcare system is based on three main criteria: accessibility, efficiency, and quality. By achieving all three, we will in fact be able to reach utopia. And what better way to understand if these implementations would be functional down here on our planet than by utilizing practices we already use down here on Earth. Now let's start with accessibility. The World Health Organization defines universal health coverage as ensuring that all people have access to needed health services without financial hardship. As we all know, a key element to consider is how we, in turn, finance our system, with one extreme being the US system, in which each individual pays out of pocket for their own healthcare costs. While this system may seem efficient, it places a huge financial burden on the individual themselves. On the other end, we have the UK, with the NHS providing free healthcare to all. While this, in turn, creates an extremely equitable and affordable system, it also comes with its own unique problems, like long waiting times and a lack of immediate access to specialist care. It is therefore vital that we meet in the middle of these two extremes, a high quality of care at a low cost. So what country would that be? Well, the answer is Norway. In Norway, healthcare is a fundamental right to all citizens. The country's national insurance scheme covers every single resident. This system is funded through general taxation, which means that everyone contributes based on their income and everybody benefits. This social solidarity fosters a sense of trust in their healthcare system. Another area in which Norway excels is in reducing health disparities. The government has implemented various policies to ensure that rural and urban areas alike have access to high-quality healthcare. For example, their adoption of the use of telemedicine. This allows the country to run smoothly, as it allows health practitioners to connect with their patients remotely. And that means no long waiting times. Another country vital to consider is Thailand. In 2002, the country implemented its universal coverage scheme, a game changer for improving accessibility across the entire country. The UCS is another system that operates through general taxation, making it essentially free at the point of use for all of its citizens, costing around the equivalent of $1 to access the wide variety of services they have on offer. This minimal fee structure not only makes healthcare affordable, but simultaneously fosters this sense of value and responsibility towards the system in their users. The country has also placed healthcare facilities strategically across different regions to ensure that equitable access. With another facet of this inclusivity is their covering of everyone, from ethnic minorities, migrants, and even stateless individuals. This commitment to inclusivity embodies the true spirit that we look for in international healthcare. And if we take one major thing from Thailand, it is that complete reform is achievable, and we should not be afraid to take that step. So what can we learn from countries like these? Well, the main takeaway is in order to be successful in the creation of an accessible system for all, it's to place a great emphasis on both equity and affordability. By having a tax-funded system that covers everyone no matter their background, but also having that freedom of a dual system, allowing people who want to pay for extra coverage, meaning that they can, and strategically placing facilities in rural environments, whilst also using the wonders of technology to engage in that specialist care, we are one step closer to utopia. Okay. So now we have an affordable system that is accessible to everyone, just like the people in the story did. But they had short waiting times, and we don't have that yet. So next, let's talk efficiency. Ranked the most efficient healthcare system in the world by Bloomberg, we find Singapore. Its sustainability is based on its unique ability to differentiate between that casual consumer and fatal incidents. Their approach to primary care is amongst the best in the world, with GPs serving as that first point of contact for patients, where the focus is not placed on management, but early diagnosis, which in turn, in the long term, reduces the need for that extensive specialist treatment and hospitalizations. Furthermore, the transparency of the system and its data-driven approach means that Singapore is able to continuously make improvements to its system and ensures that all their resources are being allocated effectively. As well as this, public hospitals are regularly audited, and that information is made available publicly, which in turn, fosters a culture of accountability and excellence. Another country that we should delve into is Japan, boasting one of the highest life expectancies in the world. So what is the secret behind Japan's healthcare efficiency? 2 words: preventative care. In all honesty, it forms the basis for the future. Because if we are able to get ahead of the disease, then surely we can save countless of lives in the process, while simultaneously saving both time and money in the long term. So what did Japan do to put preventative care at the forefront? Well, they do regular health checkups, which are mandated by law, and companies are required to provide annual health checkups to all their employees. Now, these checkups include screenings for the most common diseases, such as hypertension, cancer, and even diabetes. This early detection and treatment of these conditions prevent them from becoming more serious down the line, and therefore, in the long term, saving money. So what can we learn from countries like Singapore and Japan? Well, for starters, if we really want to cut down on our waiting times, we have to have one primary care physician, someone who can see the patient through their entire health journey from the beginning all the way to the end. We also learn the importance of transparency and data processing, as that is the only way in which we can continuously improve our systems. As well as this, we need to comprehend that the most efficient way to improve our healthcare systems is by performing preventative care. As through this, we can save countless of lives in the long run, and bringing us that one more step closer to utopia. All right, so now we have an accessible system that is affordable and equitable for all, and a system that is efficient. But the people in the story also had great quality of care, and we don't have that yet. So let's talk about it. A great example of a country that does this well is Germany. Now, Germany is a country that places a large emphasis on medical standards and professional training. Physicians undergo extensive training in medical fields, as they do in most countries. But Germany takes it that one more step forward and continues this education throughout a physician's career, as they need to stay up to date on the latest advancements in medicine. As well as this, patients have access to extreme variety and network of specialists, which they can choose from. Germany is also home to multiple research facilities and universities. This constant communication between academia and industry and clinical practice translates itself into medicine, and therefore, patients in Germany receive the best quality of care and benefit from the latest medical innovations. Another country that continues to maintain high standards of care is Qatar, with only 1.2 deaths per 1,000 people. This can be attributed to the extremely high doctor-to-patient ratio of 7 to 1,000, one of the highest in the world. Qatar is a country that maintains a very clear vision for the future, with healthcare being an extremely big part of its broader national vision of 2030. The country has invested significantly into building that sustainable healthcare system that will last the test of time. Qatar also maintains high standards of accreditation, and if you want to become a doctor and work in Qatar, you have to pass a number of tests. By working with international bodies such as the Joint Commission International, Qatar ensures its adherence to global best practices in healthcare delivery, whilst also maintaining that high level of patient safety. So there we go. By having access to highly accredited individuals at the top of their respective fields, and by investing into building this infrastructure that will last the test of time, we can start to build a high quality of care for patients. So now, let's put it all together. We would finance the system through general taxation and allow it to be a dual system. We would also charge an extremely low minimum fee, like we see in Thailand, and ensure that we had clinics dispersed throughout the regions, utilizing the wonders of technology like telemedicine to converse with specialists who may be farther distances away. Each person would have a primary care physician who saw to all of their healthcare needs, but also have the freedom to choose from a wide variety of specialists when necessary. We would also maintain transparency in every hospital and continuously audit them every few years to ensure that there is a high level of care and efficiency being maintained. We would also invest into constructing technologically advanced facilities that would last forever, while simultaneously placing a strong, strong emphasis on early diagnosis and preventative care, as that is the way forward. And there we go, the blueprint for utopia. And whilst every example used today have been different in their methods of funding their systems or in the emphasis they place on certain aspects of medicine, it is one thing that connects them all, and that is the value they place on their healthcare workers. To truly provide and create an accessible system that delivers high quality of care to all patients, we need to begin to value every single member of the team. All the way from the cleaning crew to the high-profile surgeons. Everyone needs to feel seen and valued. So in reality, that is the most important part of this blueprint for utopia. Thank you very much for listening.